Bonjour tout le monde. Good morning, everyone. My name is Krista McKee-Sampson, and I'm a member of the Board of Directors here at the Ottawa branch. Please start by forgiving me. I have a bit of a cold, so I will try to be as clear as I can. I would like to begin by recognizing that the Ottawa branch is located on the unceded territory of the Algonquin Anishinaabe Nation. We extend our respect to all First Nations, Inuit, and Métis people for their valuable past, present, and future contributions to this land and to our country. On behalf of the branch, I am pleased to welcome you to today's webinar, Healthy Aging Skin. I want to give a warm welcome to today's presenter, Sarab Dormani. Sarab is a registered nurse and co-founder of Natural Skin and Soul Wellness here in Ottawa. She has been presenting healthy aging webinars with the branch since 2022, and we're delighted to have her back with us this morning. Today's session will focus on healthy aging skin. You'll learn how to maintain a natural complexion and address common concerns like dryness, sensitivity, and age spots. Sarab will also explore effective skincare routines and talk about holistic strategies for achieving healthy skin. Veuillez noter que le webinaire sera présenté en anglais, mais la participation bilingue est toujours encouragée. I want to give a special welcome to anyone here who is not yet a member of the association. We hope that these webinars will inspire you to join us, and to our members, we hope that these webinars will encourage you to maintain your membership. We encourage you to help us grow by participating in our annual mega recruitment drive. Recruiting a new member will enter you in a draw to win some fantastic prizes, including 2 grand prizes of a $10,000 travel voucher and $5,000 each in cash, courtesy of Colette Travel and Bel Air Direct. We will make sure to give you details about this contest in our follow-up email. Finally, Sarab will host a question and answer period at the end of the webinar. If you have any questions for Sarab, please type them in the Q&A box on Zoom, and that way she'll be able to answer them at the end of today's session. I will now turn it over to our presenter, and thank you, everyone.
Thank you, Krista. So just give me a few minutes while I share my screen here. Oh, give me 2 seconds. All right, perfect. This over here, great. So good morning, everyone. Thank you all for joining us today as we explore the topic of healthy aging skin. And also thank you to the NAFR for hosting me today and allowing me to share my passion with you. So for those who don't know me, my name is Sarab Dormani, and I'm a registered nurse and co-founder of Natural Skin and Soul Wellness here in Ottawa. And I'm thrilled to share with you today some insights and tips on how to keep your skin healthy as your skin is continuously evolving and adapting itself. So just a quick disclaimer, this presentation is designed for educational purposes only, providing an overview of selected topics related to skin health. So it's not a substitute for professional medical advice, diagnosis, or treatment, and the information that I'm sharing with you today are of my knowledge, experience, education, research, and skills. And for any guidance or specific health concerns, I always recommend to consult your primary healthcare provider. So here's a quick overview of what we will be covering during the presentation this morning. There is a lot to discuss on the topic of healthy aging skin, and I've done my best to include as much possible within the hour we have. But if there are any topics that I don't get to cover, feel free to bring them up during the Q&A session at the end. So for those of you who don't know me, I'm a registered nurse with over 12 years of clinical experience. And before founding Natural Soul Wellness, I worked as an emergency room nurse. And my inspiration to co-found our wellness clinic came after years, a few years ago when I began specializing in medical foot care and also medical skincare. After leaving the emergency department, I was inspired to create a wellness center where people could walk in and feel good and receive services focused on health, wellness, beauty, and preventative care. So we were just days from opening our clinic when the pandemic had hit back in 2020, and that obviously totally changed our plans. So we were forced to face a lot of restrictions and limitations at the time, and it also forced us to rethink and restructure our clinic. But despite those challenges, we have adapted ourselves and grew over the years and really became a thriving part of our community. And this is really thanks to the incredible support that we've received from our loyal patients over the years. So over the years, we've had the chance to expand our services, mostly in response to what people truly needed and also wanted. And I'm really proud to say that with our growth this past spring, we've rebranded our clinic from previously known as Natural Soul Wellness to Natural Skin and Soul Wellness Clinic. Over the years, we noticed that it was really important for us to incorporate the skin element of wellness in our name and branding, because if you look at all of our services from facial, manicures, medical foot care, laser treatments, massage, reflexology, acupuncture, body treatments, basically skin wellness is really rooted in all of these services. So as practitioners, we're always in direct contact with our patient's skin during treatments. And we've also had over the years so many patients asking us questions and recommendation on how to keep their skin healthy, whereas it's on their face, on their feet, on their hands, their nails, and the skin on their body. So I'm proud to say that our clinic, we really focus on that natural health and beauty and wellness, and ensuring that every service that we are offering our patients help them achieve their overall, that overall sense of feeling great in your own skin. So just quickly over here, this is our very diverse team of wellness professionals at our clinic. So at the far left, you have myself, and then followed by my two medical estheticians and skincare experts, Amanda and Milka. And then after that, we have our other three registered foot care nurses that provide foot care at our clinic. And they're also nurses who are specialized in wound care in the community. At the bottom, to the left, we have Dr. Rad, who is our orthotic dispenser and chiropractor. You might have met her previously in previous webinars as we presented together. And then we also have our other members of our holistic health team, our registered acupuncturist, our registered massage therapist, and certified reflexologist as well. And finishing with Frederick, who is our manager and patient care coordinator at the clinic. All right, so we're going to start talking about the importance of your skin's health. So here's a few facts that are good to know about your skin. So your skin is the largest organ in your body, and it weighs about 8 to 10 pounds. It acts as a protective barrier against external agents such as bacteria, toxins, UV rays, and so on. And your skin also has its own microbiome and ecosystem, so therefore it plays a very important role in supporting your immune system. It also regulates your body temperature and moisture through sweat glands and blood vessels. It has incredible healing and self-repairing properties by helping tissue regeneration and wound and scar healing. It can detox through sweat glands and the lymphatic system. And it also has an amazing absorption property. So if you apply like a topical medication, you can have it absorb rather quickly on your skin, and it's absorbed through the skin, transported into your body circulation. But obviously that can also be dangerous if ever you are unintentionally exposed to like a chemical product. The skin also has elasticity properties, with collagen and elastin being the main proteins that provide the skin's ability to stretch. So if you just think about a woman during pregnancy, how her skin on her abdomen has that ability of stretching over the course of a few months. The skin also renews every 28 to 40 days, depending on the areas of the body. And it's known to shed about 30,000 dead cells every minute. Our skin evolves as we age. And I know for a lot of us, we do miss our baby smooth, soft skin that we never really got to know. And that's, we're going to be talking about our aging skin today. But most importantly, although I've kind of went through a lot of sort of physical factors, there is a lot of mental health and wellness component related to skin health because our skin can really influence how we feel about ourselves, our self-esteem, and our sense of well-being. It's very visual. It's the first thing that we see about ourselves or that we see in other people. And it's also a part of our intimacy. It's also a part of our identity. I mean, it varies between ethnicities, and it also plays a very big role in certain cultures. And also the other thing that's important to know is that your skin can be influenced by your lifestyle, nutrition, and stress level. So what does happen to our skin as we age? So first of all, there is a loss of elasticity due to the decrease of collagen and elastin production. So our skin becomes more saggy and less firm. Our skin also becomes thinner, making it more fragile and more easily prone to injuries. So due to hormonal changes, certain medication or health conditions, we do notice a decrease in our skin moisture. So our skin does become a bit more dry. One of the hormonal changes is that there is a decrease of estrogen and testosterone, and that affects how our sebum is produced. So basically our natural oil glands. So there's that slows down, and that can make our skin feeling a lot more drier overall, not just on our face, but on our feet, on our body. Our skin turnover also decreases due to decreased circulation. So cuts and bruises can take a lot longer to heal. Age spots and sunspots are also another common condition that we see in the aging skin, mostly because there's been an accumulation of sun exposure, and that kind of causes pigmentation changes. So with collagen loss of skin tone, dry skin, and repeated facial expressions, we do see an increase of wrinkles and fine lines. And there is also more increased sensitivity with aging skin as it becomes more fragile. There's also certain conditions like neuropathy that can reduce nerve sensitivity, and therefore it is difficult for us or patients that have neuropathy that we see they can't sense pain, pressure, or temperature changes. There's also, unfortunately, a risk of skin cancer that is more noted in the aging population due to years of UV exposure. And with everything that we've mentioned with hormonal changes and changes in our blood circulation, we do notice changes with nails and toenails as well. So you can see that as we age, our skin does undergo a lot of changes. Some are within our control and some that are not. So while we can't really turn back the clock, my goal today is to highlight some key skin conditions and offer a few recommendations to help manage them. So the first condition that I wanted to cover today, and honestly, I could do an entire presentation on dry and dehydrated skin because it is a very, very common condition that we do see, especially with the colder months coming up. So some of the causes of dry and dehydrated skin is, as mentioned, reduced sebum production. So we don't have those natural oil glands that help naturally moisturize the skin. So that's those oil glands, well, with the sebum, the oil, it helps to protect the skin from friction and infections usually. We mentioned also hormonal changes. So the reduced estrogen and testosterone can increase the risk of dry skin. Health conditions such as diabetes, thyroid issues, kidney issues can affect the skin's hydration level, as well as the side effects of certain medications such as blood pressure medications or diuretics. Climate changes, our environment, winter, definitely in the winter months, most of us do feel our skin is a lot more drier. There's the harsh wind inside, and then we come back inside and we have the heat on. It's very, very dry. There's not a lot of humidity. So these are all factors that can contribute to dry skin. And common symptoms are irritation, itchiness, flaky, cracking, tight, dull texture. The skin can become dry enough that it breaks the skin barrier, and that's where we are usually worried because it can increase the risk of infections because your skin barrier, which is protecting you from the outside, is broken. So sometimes we see that also in our patients that have really, really dry skin at their feet and the heels start cracking to the point that they're bleeding. So that's really a cause for concern. So what do we recommend for dry and dehydrated skin? So I typically recommend moisturizers that are that contain hyaluronic acid or glycerins or ceramides. If you don't know where ceramides are, they're lipids that are naturally found on your skin, and it helps strengthen your skin barrier, which prevents moisture loss. So think of your skin cells as like the tiles on the floor, and think of the ceramides as the grout in between that kind of holds everything together. I also recommend body moisturizers with that contain ingredients such as urea, jojoba oil, or shea butter as well to hydrate. Definitely recommend hydrating around the eyes, the lips, the hands and the feet. So different parts of our body, different type of skin. So like the skin on around your eyes and your eyelids is the thinnest on your body. So it's good to have specific eye creams for that rather than putting a very, very heavy, rich moisturizers around the eyelids. Around this time, my lips are always dry and chappy, so I have to have basically a lip balm or a lip cream like in every purse, every level of my house. So I always feel like I'm reaching out for something to hydrate my lips. If you have sensitive skin on your hands, it's not bad to have a hand moisturizer. And obviously, I always recommend having a specific cream for your feet if you have really, really dry skin on your feet and you feel like your body moisturizers are just maybe not hydrating enough your feet. I also recommend doing a gentle exfoliation just to remove any dead, dry skin that maybe hasn't shed completely. And it also prevents flaky skin to clog the pores, but also by exfoliating and removing all of that dry skin off, when we go and hydrate, it actually penetrates a lot better in. I also recommend doing maybe seasonally like a hydrating, a moisturizing facial. So a facial that can really, really deeply moisturize and replenish the skin, improving the skin texture and providing just a healthier, more glowing complexion. Definitely stay hydrated. Avoid really, really hot showers or hot baths or hot soaks because water tends to naturally pull natural moisture off of out of your skin. So usually after a shower or a bath and things like that, it's good to definitely moisturize your skin. Protect your skin, especially in the winter months. So wear gloves, scarves, closed shoes. And in the house with the low humidity because of the high heat, I do recommend using a humidifier. So just quickly, the before and after are actually pictures of myself using a specific eye cream from our moisturizing facial skincare line. So I get really, really dry, patchy skin on my eyelids during the winter, and it's definitely a must to keep them hydrated. So this is over a course of a few weeks. So sometimes with dry, dehydrated skin, we can be left with having more of that sensitive skin. So we'll talk a bit about sensitive skin and rosacea. So again, causes are thinning of the skin and the weakened skin barrier. However, there are, genetic factors or family history of skin sensitivity that can get passed on. And there are certain triggers like alcohol, spicy food, stress, anxiety, using really, really harsh products, over exfoliating, also like being exposed to UV rays or harsh winds and certain medication or certain conditions like going through chemotherapy that can make your skin a lot more sensitive. And basically your skin becomes more sensitive to the environment. And then with rosacea, what we notice is more of that facial redness, sort of that flushing and more visible blood vessels. Rosacea can kind of be on its own without a flare-up, or it can overlap with sensitive skin. So just quickly, symptoms are redness, inflammation, that skin flushing, skin irritation, so having that tingling, burning sensation, or having plaques of thick skin on your face or areas of your body that feel tight, that's peeling, that's drying, that's cracking. It's a very, very uncomfortable feeling. So what we recommend with sensitive and rosacea skin is it's important to identify triggers, especially dietary triggers. So if you know certain foods that are causing flare-ups, please avoid them. It's important to protect your skin from external hazards such as pollution, smoke, winds, cold weather, or if you're in environments with a lot of humidity. Definitely recommend protecting your skin with an SPF of 30 and over. So with sensitive skin, we typically recommend a sunscreen that is more like a mineral sunscreen because it's more of a physical blocker. It's free of chemicals, and it also contains zinc, and zinc is known for soothing inflammation. And the great thing about a mineral sunscreen is that it applies immediately. It works immediately when you apply it. We also recommend having a very gentle and simple skincare routine. So keeping it more to cleansing your skin very, very gently and also moisturizing. So I don't typically recommend any harsh exfoliants or any exfoliation with rosacea and sensitive skin during flare-ups, especially. So we recommend avoiding any retinols, vitamin C, or any serums with active ingredients. One of my favorite treatments at our clinic is our soothing facial. So it's a facial that uses our soothing line of skincare, and it's combined with a lymphatic massage and gua sha techniques to just help calm the skin and promote circulation again. We also recommend either light therapy so light therapy basically has near infrared A light that can help with calming skin inflammation. And if patients with rosacea are not in a flare-up and want to sort of diminish the blood vessels that are often seen around the nose, around the skin, then we can recommend IPL treatments or laser treatments, and making sure that these treatments are done when there are no flare-ups. However, if there is any increased sensitivity and inflammation, it is always important to have those symptoms managed by your primary healthcare provider, because we want to help control those symptoms, but we also want to reduce the risk of skin infections, because when the skin barrier is broken, that's where pathogens like bacterial or fungal infections can get in. All right, so we're going to dive in now into recommendations for wrinkles and fine lines. So we've mentioned before, there's a decrease of collagen and elastin production. And with that, the skin gradually loses its firmness and smoothness and elasticity, and it just can't bounce back as easily. Repetitive facial expression over time can create dynamic wrinkles, and dry and dehydrated skin can also increase sort of the creases and fine lines that are seen on the skin. Sun exposure breaks down our collagen on our skin and can actually cause what we call photoaging, so accelerate the aging process. And then the loss of fat under the skin can also make the skin look a bit more saggy, as the skin structure is not able to hold itself anymore. And also lifestyle habits such as smoking, alcohol, recreational drugs, poor sleep, and diet can increase the aging skin as well. And so areas affected basically around the eyes, lips, forehead, jowls, cheeks, and neck. So recommendations when it comes to managing wrinkles, fine lines, and loss of skin tone. So lifestyle changes, so trying to limit or avoid smoking, alcohol, and just really promoting more of a healthy lifestyle. So having a rich, balanced diet, exercising just to always help promote that healthy circulation in your body as well. Skincare is definitely a must. So using a good quality cleanser. And if you are going to use active ingredients such as retinols, vitamin C's to kind of help with that cell turnover and helping promoting collagen and things like that, then it's always good to do it in guidance with a professional guide rather than trying to read about it online or going in the store and just grabbing something because it's on sale. Moisturizing is important. So using hydrating moisturizers with peptides, growth factors that can help sort of boost your collagen production, but also moisturizers with hyaluronic acid and ceramides that can help strengthen the skin barrier and keep your skin hydrated. And definitely sun protection is a must. So again, we want you to wear your SPF 30 and over, but we also want you to protect your skin by wearing hats, sunglasses, just so that because if you don't wear sunglasses and you go out in the sun, you're basically forced to kind of frown your eyes. So that can also increase those like facial expressions that we talked about that can deepen those wrinkles. So advanced treatments that I typically recommend, and there is a lot out there, but I really tend to focus more what we offer at our clinic, which is more natural and non-invasive. So I would say one of the most popular ones are radiofrequency treatments that help stimulate collagen and elastin production. And it helps to tighten the skin and reduce the appearance of wrinkles and fine lines. So these treatments are typically non-invasive with no downtime, but you do need a series of treatments before noticing visible results. And then over here, we do have a before and after of one of our patients at the clinic who did a combination of radiofrequency treatments with more hydrating facials as well. So you can see that the skin complexion is just a lot more smoother. Gentle peels and facials are great because they help exfoliate the skin surface. So by removing the dead cells and promote cell renewal, which helps reduce the appearance of wrinkles and fine lines by just making the skin look a lot more smooth, a lot more fresh. There are other options such as nanoneedling with radiofrequency, which is a technology that helps create little tiny micro channels in the skin. And the radio frequency is released a bit more deeper into the skin layers, and it just stimulates a bit more intensively that collagen production and helps improve more pronounced skin textures. And one of my favorites is obviously laser skin rejuvenations, which helps stimulate collagen production, promote skin renewal, and smooth texture. So there are a few different options for sure. However, when you are considering professional treatments, it's really important to choose options that really align with your personal goal. And that's why I always recommend a detailed consultation to discuss your concerns and how we can best address them. So it's important also to have realistic expectations and take more of a holistic approach, mainly because professional treatments alone are not enough without proper at-home care. So if you are going to do a series of, let's say, skin rejuvenation treatments, but you don't bother putting your SPF when you go out in the sun, then there's really no point. In some cases as well, we might need to use combination treatments. So kind of recommending radiofrequency paired with like periodic lasers, that can happen as well. But the other important thing is that ongoing maintenance is important because the aging process does continue. And so while I can't really change your DNA, at least together we can explore what works best for you through this journey. And so that brings me to talk about age spots and sun damage. So age spots and sun damage is a lot more prominent in individuals over 55 and over, mainly because of the exposure to the sun over time. And I know a lot of my patients, they often tell me back in the days, there wasn't that much awareness about sun protection and sunscreen as there is today. So I'm here to raise that awareness about sun protection. But basically, sun exposure over time can damage the skin's pigment-producing cells, which is called the melanin, and lead to hyperpigmentation. What I've also noticed over the years is that I do feel like the UV rays are a lot more stronger than they used to be. mainly because of the thinning of the ozone layer. So that's there is more of that risk of sun damage and also sunburns. So as I mentioned, unprotected and prolonged sun exposure is definitely a main risk factor, but also thinning of the skin can make you more prone to sun damage. And there's also hormonal imbalances, such as the reduce of the lowering of the estrogen and testosterone can disrupt our melanin production. And so our skin can either have a lot of those like brown spots or can really feel more like leather-like skin. And areas that are affected are typically areas that can be directly exposed to the sun. So just before we talk about recommendations, I did wanted to share this viral picture with you. This is really honestly one of the best examples that we have about the powerful effects of the sun and how it can damage your skin. So this is a viral picture from the Huffington Post from a 69-year-old truck driver. As you can see, the left side of his face was continuously exposed to the sun rays through his truck windows, and you can see that there's been a lot of visible damages on his skin. So moral of the story is wear your sunscreen and protect your skin. So I think I've mentioned about sun protection and SPF, but basically when it comes to sun protection, hats, glasses, also long sleeve shirts and pants when possible, obviously keep it light. But with SPF, the one thing that's also important is reapplication. So it's not just putting it on in the morning, you do have to reapply it throughout the day. And also everywhere. So if you are going to be outside at the beach, in the sun, don't just put sunscreen on your face. Really make sure that you cover your body wherever your skin is exposed to the sun, front and back. The other thing, it's also important to consider SPF during the winter months. Anytime that the UV rays are over 3, it indicates that the UV rays are strong, enough for you to need to apply SPF. And in the winter months, we don't think about it, but the snow is actually a big reflector. So it reflects the UV rays and they can bounce a lot more easily. So it's important to apply your sunscreen during the winter months as well. Exfoliation helps to remove dead skin, vitamin C serums and creams. Well, vitamin C is an antioxidant that helps brighten the skin, but also reduces the appearance of pigmentation and fine lines. If you are considering professional treatments, brightening facials that use vitamin C are great. Gentle peels and microdermabrasion help with that skin exfoliation. But in my professional practice, the most successful treatments that I have seen when targeting age spots, pigmentation, sunspots is definitely IPL and laser treatments, because that's really what's going to even out the skin tone. The laser is going to sort of shatter the pigment. Your body's going to reabsorb it. Now, depending on some pigments, it can take a series of treatments to achieve desired results. And you can see some of the before and after pictures that are shared here. You can definitely see some visible improvement with the series of treatments of IPL and laser treatments. So I did wanted to take a few minutes to just quickly talk about skin cancer, because I do often see patients coming in and pointing out at something that's been growing either on their chest or on their legs and are not sure what's going on. Now, I'm not a dermatologist. I'm not going to be there to diagnose, but if I do see something suspicious, I highly encourage my patients to have that checked out as soon as possible. So if you do have anything that just doesn't look right, then definitely have that checked out. Skin cancer is unfortunately still a very, very common type of cancer. But the good news is that early detection can lead to high treatment success rates. And when we talk about skin cancers, we always say know your ABC, DEs. So basically, Just quickly, A is for asymmetry. So if you look at a mole or a lesion or a spot and it doesn't match the other half, then you can tell yourself that it might be abnormal. B is for borders, so if the edges are irregular. C is for color, so if the color is uneven or has different shades. D is for diameter, so any lesion that would be bigger than about the size of a pencil eraser is a cause for concern. And E is for evolving. So if the molar lesion is changing in size, shape, color, it's elevating over time. If you're noticing these signs, then it's important to have it seen as soon as possible. I always like to share the story of a patient that I had come in at my clinic, and I had noticed a lesion on his leg, and it looked like a persistent sore. It wasn't healing. He kept on saying that it was always itchy and bleeding, and that was during the pandemic where no one was able to see their family doctors. You could only get through a phone call. So I had written an urgent report to his family doctor. And the next time I saw the patient, about 6-8 weeks after for a follow-up, he had told me that the family doctor saw him right away, sent him to a dermatologist. They did a biopsy and ended up being skin cancer, and he had it removed by plastic surgery. So it was done very, very quickly in between two of the appointments that I had seen him. So I'd like to briefly touch on nail and foot conditions related to skin health, although I won't go into much detail since I've covered this topic very extensively in other presentations with the NAFR, and you can always have a look at the previous recordings. But here is a quick overview of some common concerns that we do see in older adults, although they're not really exclusive to aging, but rather a result of life experience and changes that we notice with the skin as we are aging. So toenails becoming thicker, fingernails can become more brittle. We can see an increase of skin sensitivities with eczema, psoriasis, also fungal infections to both the skin and the nails, dry cracked heels, corns, calluses, leg swelling due to poor circulation, but also leg swelling can also change the skin's health, and diabetic foot ulcers that we are still seeing, unfortunately. So just some recommendations with nail and foot concerns. Again, topics that I've covered in previous presentations, but regularly trimming, filing your fingernails and toenails is important. Moisturizing your skin, so with a urea-based cream. So I sometimes have patients coming in and the skin on their feet is still dry and cracked despite them using like their body lotions at home. That's where I really tell them, okay, we need to look specifically for a foot moisturizer, because whatever you're using at home is just not enough for the skin on your feet and on your legs. If there are any fungal infections, it's important to treat them. Daily foot checks and hygiene is important. Proper and supportive footwear helps with reducing corns and calluses. Protecting your skin with socks. So if you wear shoes, please wear socks in it. It not only helps to have that moisture control, but it also reduces the risk of your foot sliding and causing friction and possibly painful calluses to your feet. I did wanted to talk a bit about the importance of leg health and leg swelling, mainly because I was inspired because I had a follow-up with a patient that I saw a few days ago at our clinic. So at the bottom, you have his before and after pictures. And just an FYI, all of the pictures that we're sharing today are with patient's permission. So this is a 93-year-old man that I saw last year for lymphedema, so really, really heavy swollen legs. And he was just out of options, and he just didn't know what to do when he came to see me at the clinic. And his skin was very red, very thick, leathery. He had just finished antibiotics because they kept on treating him for skin infections, and it was very itchy. He was just in a lot of pain. So being a certified fitter, I started him on some compression bandages, compression therapy, and put a lot of focus on making sure that he was wearing compression bandages that were well fitted, but also including a very strict skin health regimen for the skin on his legs, because we wanted to reduce the risk of that skin sensitivity that I was feeling, but also reduce the risk of infections to his leg. And then the after picture is a year afterwards of him religiously wearing his compression bandages and doing his skin regimen. And I know he was on top of his skin regimen because his daughter was coming in every few months back at our clinic and purchasing the creams that was helping with his skin health. So he's really, really happy, and it definitely did improve his quality of life. So we can see patients having skin irritations when they have swollen legs because all of that fluid is coming in between the skin cells, and that is a fluid that can be very, very irritating for the skin. So there are some risks associated to that. So if you do have swollen legs, itchy skin, it's important to have it checked out. You might need compression garments. And if you are looking into compression garments, it's important to find yourself a certified fitter that will properly measure and fit you. And then unfortunately, we do still see patients coming in with diabetic foot ulcers. Now, the important thing to know with diabetic foot ulcers is that prevention and early detection can save limbs. And if you're not sure about your nail and foot health, then I definitely recommend always seeing a medical foot care specialist to help you with your foot health. All right, so I know this was a lot of information, but let's just quickly go over some key takeaways. So just very, very quickly, when we are looking about how to keep our skin healthy throughout our entire life, then healthy lifestyle is important. So quality sleep, nutrition, hydration, exercising, and avoiding or limiting certain things like smoking and alcohol consumption. Your skincare routine is definitely a must. It's important to have good products because you also have to tell yourself your skin has that amazing absorption rate, and whatever you apply in your skin is basically food for your skin. It's your skin nutrition. But also know to keep your skincare routine very, very simple. Sometimes it can be overwhelming on the internet. We see people with like 20-step skincare routines. I don't do that. My skincare is very simple. I make sure I have my cleanser, I have my targeting serums, my moisturizer, and my sunscreen. Sometimes I'll have like a serum that will maybe target something a bit more specifically, and I'll exfoliate once or twice a week. But other than that, it's also important to know that you do need to adapt, however, your skincare to your climate and to the season. So it's normal to change moisturizers between the summer and the winter months because our skin just goes through a very, very different cycle with our seasonal changes here, especially in Ottawa. And also adapt your skin to your traveling. So I'm a Florida girl. If I do my winter skincare in Florida, I am going to break out like crazy. So I know that I need to adapt my skin to where I am. Also, it's important to protect your skin. You should know that by now. So sun protection, SPF 30 and over. It's important to reapply. There are some differences between mineral and classic sunscreens, and that can also come down to a personal preference or just what kind of skin you have. So that is something that we can always recommend with guidance. Physical protectors, hats, glasses, all very important. And in the winter, definitely protect your skin. And if you were to consider professional treatment, always make sure that your professional treatments are personalized to you. Definitely always recommend a detailed consultation just to know what your goals are and know what your options are and what is suited for your skin type, but also your current health conditions. So sometimes there are some treatments that we just can't do. So if you do have a history of cancer, then radiofrequency treatments are not often recommended. We'd have to explore other options. And the important thing is to be very realistic with your results. All right, so that brings me to just quickly wanted to take a few minutes to say, if you haven't known from previous newsletters sent by the association, our clinic, Natural Skin and Soul Wellness, is excited to offer NAFR members an exclusive promotion where you get 45% off our VIP membership, unlocking a range of an amazing promotions and benefits. And with the 45% off our yearly membership. That also includes a free hydrofacial valued at $200 just to start your skincare journey. So this is a great opportunity to experience some of our most popular skincare services while enjoying amazing savings. And on top of everything that we are offering, we're also offering all NAFR members until the end of the year a free consultation with any member of our medical aesthetic team, and that consultation is valued at $50. So if ever you have any questions, concerns about your skin, this is a new topic for you, you don't know where to start, well, we're more than happy to offer you the free consultation with either myself or my medical estheticians, Amanda and Milika, who are absolutely amazing. I think we'll be posting a link here in the chat box that will give members access to the NAFR exclusive webpage with all of the details about the membership promo, but also with the promo code and also the voucher for the free consultation. So this link is exclusive. It's not found on our website. And basically, yeah, so we're here to really help you feel your best in your skin. All right, so thank you all for your time and attention today, and I hope that you found the information to today's presentation helpful in understanding how you can care for your skin as it ages, and the many ways that we can also support your wellness journey. So if you have any questions, I'm available for a few minutes now. Thank you.
Thank you, Sarab. We do have a few questions. Some of them are pretty quick for recommendations type of thing. So the first one is, what is gentle exfoliation? And can you give examples of what products should include?
Gentle exfoliation, I really like sugar exfoliation. So when you're looking into exfoliations, it's important to, first of all, find an exfoliation for the right skin. So I wouldn't use a body exfoliation on the face and vice versa. So if you are exfoliating the face, use a face exfoliation. And I like exfoliators that have very, very gentle ingredients or hydrating ingredients or sugar exfoliates because sugar is also very, very hydrating. So that's what I recommend.
Perfect. Can you also give an example of a mineral sunscreen and what to look for on the label?
Yeah, so with mineral sunscreen, so it would be written that it's a mineral sunscreen, depending on the brand that you're looking for. We do carry different brands at our clinic as well. But basically it would be written mineral sunscreen, and typically there's zinc oxide in it. So with mineral sunscreen, it has physical barriers. So if it's not written mineral sunscreen, then it's probably more of a classic sunscreen.
Okay. And next is Strivectin, a retinoid.
Oh, and let me just research that quickly.
And then the next question while you're looking in that is, do you have a dermatologist at your clinic, or do you refer outside of the clinic to a dermatologist?
We don't have a dermatologist at our clinic, and I know there is a bit of a challenging, it is a very challenging area in our province to see a dermatologist. Often for medical conditions, it can be at least a year or two out wait. Referrals they typically need to be done by either a family doctor that will initially diagnose you with a condition and then send you out to a referral to a dermatologist for certain conditions. But there are dermatologists or physicians with a dermatology expertise that have cosmetic clinics throughout the city, but it is a pay as you go method. I don't think those ones would be OHIP covered if you want to kind of see a physician without a referral. And oh, sorry, I'll just see the chat here. Oh, I can't see the questions.
Yeah, sorry. So we were back to Strivectin being a retinoid. It's an
I'm not
example.
so sure. It's not something that I had heard of in the retinoids, but I'm just researching about it. Oh, oh yeah, it does say that it's a brand though.
Yeah, strivectin is a specific.
Yeah, so there's different, well, in the brand there are different ingredients. So if you do get the advanced retinol collection, then you will have retinol in it.
Okay, thank you. Then there's also kind of more of a comment on someone with experience with rosacea and the food intolerance side that you mentioned,
Mhm.
and wondering if you recommend using also in combination with a natural path to address rosacea in addition to treatments.
Absolutely. So anytime like, you have any food sensitivity, it's definitely good to include either a naturopathic doctor or a nutritionist, a dietitian to help you see what food can trigger certain symptoms. I've had patients coming in with skin sensitivities that I've referred out to naturopathic doctors. Again, we mentioned that skin health is a holistic approach, so it's good to sort of incorporate other holistic members into your healthcare team.
Great. Yeah, this person also mentions having a food panel done, that type of thing with the naturopath.
Oh, great.
More of a comment that.
Yeah, that's great.
hmm And then the next one is, what about a vitamin C serum before moisturizing? Is this good to use if you have older skin on a weekly basis?
Yeah, so as we mentioned before, vitamin C is a great antioxidant. You can use a vitamin C serum, making sure that you don't have any skin sensitivities once or twice a week. I love personally my own vitamin C. I use it twice a week. And there's different concentrations of vitamin C, so that's always important to look into with guidance, because you don't want to have something too harsh if your skin doesn't tolerate it either. Our vitamin C's at the clinic are more encapsulated, so they kind of have a slow release. So when you apply it on the skin, you don't get that burning, tingling sensation that you can sometimes get with certain vitamin C. So that's why when you are going into active ingredients, I always recommend having it done with professional guidance.
Okay,
And then yes, and then you would apply your moisturizer after.
thank you. So two questions kind of similar, well, similar in nature. One is, what treatments do you recommend for bags and dark circles under the eyes? And then the second part of another question, if you've lost weight and skin is now sagging on your face, arms and legs, what suggestions for moisturizers?
Okay, so for the dark circles, a bit biased, but us at our clinic, we do offer radio frequency and treatments for the dark circles and just help to sort of tighten a bit the loose skin that you kind of have around the eyes, but also with radio frequency. And there's a combination of pulse electromagnetic fields. It just helps promote collagen stimulation and promotes also better circulation. So sometimes with dark circles, you can just have more of that accumulation of hemoglobin that is under the eye. So you kind of want to help promote the circulation. And it just helps smoothen and lighten as well. And then with the other question, I think it was the weight loss
And
and a
sagging
lot of
skin.
sagging skin. So it always depends the extent of the sagging skin. It's very difficult to say because it doesn't seem to be just on the face. It's like pretty much
Yeah.
everywhere on the body. Um, so again, it always depends how much weight that was lost and how much sagging skin there is, because if there is an extensive amount of sagging skin, then non-invasive treatments like we offer might not be sufficient. This might be something where you need to consult more of a physician and see if there is any skin lifting that needs to be done, but that's not my area of expertise.
Okay, thank you. How often do you need IPL laser treatment to keep age spots invisible? Meaning, how long after treatment will the spots typically reappear?
So once we treat the spots, You shouldn't come back unless you're re-exposing yourself to the sun and not protecting your skin. So if there's new spots that are coming, it's probably because it's a new exposure. It's not because the technology didn't work. So basically just make sure you're doing your homework.
So the next question is on keratosis patches. What can be done to prevent them and to treat them?
They didn't mention which area.
No, they didn't, unfortunately, but it is something they can put on their individual evaluation for you.
Yeah, so well, with keratosis, is that like dry, scaly, patching skin that's been damaged with the sun. So obviously, and that's always like a case by case to see like in clinic if we can offer any, like we talked about, very gentle, like either facials or gentle non-invasive treatments for that, or if it's something that might need more of a physician assistance and look more into like the removing it surgically.
Okay.
But it's still important to continue to moisturize and protect your skin from the sun.
Okay. This key message keeps coming through. What is the best way to address the bumps and wart-like growths that appear on your skin as people get older?
Words.
Well, bumps, like little bumps,
Okay.
that type of thing, and kind
Yeah.
of growths that
Okay.
eggs, that kind of.
Oh, okay. Well, again, that's something that we would have to see. So, because warts are more of a skin infection, so we would treat them differently than if it's just like little bumps, but we'd have to see what are those little bumps, if it's like which area of the body, because sometimes it can be patients that have really, really dry, flaky skin that don't exfoliate, and then it clogs up the pores and creates these little bumps. We'd have to see if there's any redness, any rash associated to it. So that I would typically say to have it more looked after.
Okay. So we're quickly running out of time. I'm just going to ask a couple more questions and then we'll kind of wrap up. So there's one question. Do you recommend any natural, any substitute if you're allergic to urea for moisturizing your feet?
Lanolin is a really good one. So we do carry products that don't have urea, but that have lanolin and a mix of other oils like jojoba oil or shea butter. Those are also great.
And next, what is a medical pedicure?
So medical pedicure is actually one of our pretty popular services at our clinic. So it's basically medical foot care that is offered by any of our registered nurses. So you're not just coming in for a simple pedicure. Our nurses are all specialized in foot care and offer an assessment consultation, and then they'll do more of a medical foot care, you know, taking care of your corns and calluses, maybe at a more advanced level than you would at a typical spa, and then doing your toenail trimming and filing as well. If you have thick toenails, we can debride them. We have just more advanced medical equipment to be able to provide the pedicure service. And being a health and wellness clinic, all of our instruments are fully sterilized and autoclaved, just like you would have instruments sterilized and autoclaved at a dental office.
Okay, and next, can you address skin tags? These seem to increase with age.
Us at our clinic, we don't address skin tags. There are some clinics that offer cryotherapy or little lasers that can sort of burn off the skin tag, but always make sure when you are having skin tags, address that you are doing it professionally by someone who knows what they're doing and they're not just burning off something that they shouldn't be burning off.
Okay, and the last question about kind of the memberships and related, there's two questions related to memberships. Can you get treatments on an as needed basis rather than becoming a member?
Yep.
And the second part is the yearly membership fee tax deductible as a medical expense? Are there any services covered by Canada Life?
About the membership or about our clinic?
I guess any of your services that might be covered by your insurance provider.
Okay. So, well, facials and skincare are unfortunately not covered by OHIP or by insurance companies, but some insurance companies have like a health spending account. So sometimes you get like a few $100s a year that you can kind of spend on whatever you want. This is what I've heard from patients. So if ever you do have a health spending account, you can see. But about sorry, there was another question about the membership. So if
can you get treatments on an as needed basis rather than becoming a member?
I mean, it's up to you. The membership does for the year does offer you these exclusive promotions, but if not, you can come in when you want to, and that's why we're offering the free consultation that's valued at $50. So if ever you just want to chat with someone and see kind of what works with you, if you don't need maybe everything that is offered in the membership, that's always an option, and we can explore options with you. And then services at our clinic that are covered through the retiree plan with Canada Life. This is what I've heard from patients. So the medical foot care provided by nurses is covered at 80%, I think up to $500 a year. Our acupuncture, there is coverage now up to $500 a year, massage therapy as well. We do offer compression garments and orthotics, and those I believe there is also coverage as well.
Okay, final question. Do you have a couples membership or is it all individual?
Oh, that's something we can probably look into. I can talk to my manager, but that's definitely a great idea. However, with individual members, you do also get the free hydrofacial. So if they each want a hydrofacial, that's valued at $200, and then the membership with the discount comes down to $206. So if they each want their facial, that's also good to take advantage of.
Okay, excellent. With that, we're going to have to wrap up. We're a minute over, but I want to firstly thank everyone for your participation in today's webinar. The Ottawa branch would like to thank Sarab Dormani for today's excellent session. Remember to look for our follow-up email. It will include information on how to access the recording of today's session, as well as some additional information on the NAFR's mega recruitment drive. Remember, you can invite non-members to attend our webinars and try them out as a guest. Thank you. To register for upcoming webinars, please visit the Ottawa branch website at nafrottawa.com. Thank you, everyone, for participating, and the follow-up information will be included in the recording as well as in our follow-up email, so you can reach out to Sarab directly if you have further questions, and for those that we didn't get to in today's session. So thank you, everyone. Thank you, Sarab, and we'll see you all.
Thank you for having me.
We'll see you all at our next webinar.
Thank you. Bye, everyone.
Bye.